Hi, everyone. Welcome back to another episode of Ask a Care Manager. My name is Ryan Abramski. I'm the Director of Business Development, and I'm joined as always with Teresa Jackson, our Director of Care Management. Both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 22 years. As always, the Ask a Care Manager video series is brought to you by our friends over at Senior Living Resource Magazine and their website, seniorlivingguide.com. Your one-stop local and statewide resource for all things senior housing and health. Anything from home care services like EasyLiving to assisted living, memory care, senior wellness and nutrition, senior financials, and also care management services, again, like EasyLiving. Check out the Senior Living Resource Magazine and their website, seniorlivingguide.com. And as always, if you reach out to them directly, they will mail you an issue directly to your home. And the new issue is out now. So welcome back to another week, Teresa. Glad to see you.
Thank you.
As we continue our theme for nutrition, we kind of kicked it off introducing National Nutrition Month. Last week, we kind of talked about, not only is the food important, but the environment is important to making it comfortable for our elderly loved ones to eat. This week, I think we're going to drill down a little bit further, and we're going to kind of talk about some challenges when it comes to cognitive-related diseases like Alzheimer's or any kind of dementia-based patient, and some of the struggles that they have or families might have, when trying to feed them or trying to get them to eat, or ensuring that they have a healthy diet and they're getting the nutrition that they need, even though there's those challenges there with them. So tell us or give us some advice on either what families can do or even with our care partners, what they can do to help with our dementia-related type patients.
So, yes, it is very important to keep in mind that if somebody does have cognitive issues, if somebody has Alzheimer's disease or another progressive type of dementia, such as vascular dementia, that getting the proper nutrition continues to be vitally important and also can become very, very challenging. So I'll start talking about like in the early stages, like if someone just maybe has early stages memory loss, some different things that you can do. And I'm thinking about a time when I went out to lunch. I took a client out to lunch. And I had never been to that restaurant before, so I wasn't familiar with the menu or anything. But it was one of those overwhelming menus where the sandwich was not a ham and cheese sandwich or a turkey and cheese sandwich. The sandwich was named like the Gene Lawson special. It's like, okay, so that tells me nothing because I don't know who Gene Lawson was. So you have to read the description, and it was just, so many items. It was overwhelming for me because I've always been very picky. So I have to read the description of the sandwich or the meal. And, is it something, what's in that I don't like? So my client, was studying the menu and looking, and I think I ended up ordering just like some type of one of the specialty salads. And she's, well, I'll have what she's having. So, and it got me thinking that she had issues, one, visually reading because, the menu is printed in small print. Mm-hmm. And then it's just so overwhelming to have to look at all these descriptions. So take that into consideration when you're dining out with a loved one that may be elderly, that, give them time to look at the menu, help them look at the menu. Make recommendations. Well, Mom, you've always liked, the roast beef. So I hear they have a really nice roast beef sandwich. What about that? Mm-hmm. And because it can be overwhelming. And what will happen is they will stop wanting to go out to lunch with you. And so then they'll become more and more socially isolated, which we've already talked about how that affects proper nutrition. So again, so that's in the early stages. And two, as the dementia progresses, talk about how people don't like change. Well, when someone has dementia, it's almost like that stubborn factor gets elevated to a higher level. And again, a lot of times it's because they might be missing out on part of what's going on, either hearing loss, the dementia. When someone has dementia, they're not hearing all the words that we're saying, especially if it's in the left brain where our language center is. They're not processing everything we hear. Mm-hmm. So they're hearing a broken a sentence that when we're talking to them. So when you are dining with a loved one that might have dementia, think about what their favorites are. Let's not start introducing, let's go to that new Thai restaurant, because they don't want to have anything to do with that. Maybe they, grew up on beans and potatoes and the Southern fried chicken, and that's what gives them comfort.
Familiar to them.
That's what it's familiar. So let's focus on that. And then you can go out and have your Thai food, when you're not dining with your loved one. So then when the disease progresses, they're going to have more maybe physical issues in actually eating. So look at the utensils that they're using. So mm-hmm. I know I had a client that was in a memory care community, and her appetite had decreased. And so I took a picture of the food. I'm taking a picture of the food, what it looks like on the plate. And it was, probably like a pasta with chicken and bread. So you had white food on a white beige plate. And I'm thinking, well, if I have visual problems and that I really don't see that food very well. Mm-hmm. So, and there's actually been studies done, and you can actually purchase red plates. So like if you're touring a community and you're looking at the dining room and it's memory care, are they using bright colored plates? Because that's something that stimulates the appetite, and they can actually, so what I did is I went out and I purchased these red plates for my client, and it did help. Even the way the cup is designed, if someone can't tilt their head back, drinking a cup like this, so you can get a specialty cup, not a sippy cup. They don't need a sippy cup right away. Don't do that. But it's just, there's a groove cut out in the cup that makes it to where they don't have to lean back as much. So you can look at that. Even like the rim of the plate, or a plate with a rim, it helps them scoop the food up better. So and what that does, it enables them to become more independent, or continue to be as independent as possible, is what I want to say. It helps them Absolutely. Continue to be as independent as possible. So then when, and like if someone has Parkinson's disease, maybe the weight of the spoon, of the utensils, is very important. There are adaptive equipment. So there are so many tools available. Now, when someone no longer is able to use this fork and spoon like they're supposed to, or like we would like them to when they're sitting down at the table, we focus on finger foods. And we're foods that are nutritious. Mm-hmm. So, and maybe we'll be able to share some recipes for nutritious finger foods to them. And I think about when my kids were little, trying to get them finger foods that, not just pasta, but I would take the pasta and I would put like some meat inside it, doing the roll-ups, the cheese, and the, think about stuff like that. Or like, you go to a dinner party and they have appetizers. But you also have to look at the consistency of the food. The hardness, is it too hard? Maybe they have dental issues. But it helps them preserve their dignity, because they can sit down and at the table with everybody, and they can use their fingers and still eat. Never call it a bib. We don't put bibs on. We don't use diapers, and we don't use bibs. Those are for our children. We use incontinent Depends or incontinent products, but we also use clothing protectors. And oh my gosh, I've seen some that were so creative. It would look like your shirt. So what they actually do is they take a shirt and they cut out the just the front of the shirt, and they use it as a clothing protector. So, I mean, and so the person again can maintain their dignity.
Yeah,
And you know
absolutely.
what? If and you've got small children, my children are older, but I remember and think about it when you picked up your kids from daycare, if they were still clean and didn't have anything on their clothes, do you think they really had fun that day? So you have to pick your battles. What is really important, and it's all about helping your loved one maintain dignity while eating. And then, later on when the disease progresses, because Alzheimer's, vascular dementia, it is progressive. They will continue to get worse. Okay. So you might want to bring in a speech therapist, an occupational therapist to help with, the speech therapist helps with swallowing issues. Do we need to start looking at thickened liquids, mechanical soft diets?
Yeah.
But there's a lot of options because it is still very important. And I know some people say, well, mom's 80 years old, 90, she's 100 years old. Why can't she just eat whatever she wants to? Well, that's going to be stuff that's just very sweet because, again, those taste buds change. And it's still important for the integrity of her skin, and her health overall, to have that proper nutrition. Because if let's say she gets a wound, someone that has a bed sore or a wound, the healing will be much more difficult if the nutrition is not there. So the whole skin integrity and nutritional health helps with the wound healing process. So it is still important.
Absolutely. Well, Teresa, that's awesome information, and really thank you for that, because I know sometimes that's one of the many factors that families kind of struggle with when their elderly loved ones have some kind of cognitive related disease. We want to make sure the nutrition is there, and some of these different tips of how to set them up for success and making sure that nutrition is definitely super helpful. So again, as always, we'll have more information on our website. We post different blog articles too between Facebook and our website as well. If you have any questions or want to talk about what you do for your family member or loved one that has a cognitive related disease, feel free to put that in the comments section. You can also send us a message directly on Facebook, or if you want more information about our services, whether that's care management or home care, you can always reach out to us on the Contact Us form on our website, and we'll be happy to answer any questions and see how we can help out. Teresa, thank you as always for your great input and great insight. And we thank all of you for joining us, and we'll see everyone next time.